Did you know that diabetes affects 425 million people worldwide? That's 1 in 11 people, and this number continues to grow. By 2045, the total number of people living with diabetes is predicted to rise to over 600 million. 3/4 of people with diabetes live in low and middle-income countries, and globally, as many as 212 million people don't even know they have it. That's half of all the people with diabetes. While diabetes is treatable, even when glucose levels are under control, it greatly increases the risk of cardiovascular disease, or CVD. In fact, diabetes makes people twice as likely to experience heart disease or stroke. For this reason, strategies for preventing CVD in people with diabetes most focus on lifestyle management and risk factor interventions. The World Heart Federation Roadmap on the Prevention of Cardiovascular Disease among people living with diabetes is a key reference document for anyone involved in the planning, organization, implementation and monitoring and evaluation of approaches related to CVD prevention in people living with diabetes. It outlines a vision of an ideal pathway of care, potential roadblocks along this pathway, and proposed solutions with examples from practice. For example, one of the main roadblocks identified in this roadmap is a lack of awareness of the risk of CVD in people with diabetes among diabetic patients, healthcare professionals, and policymakers. Recommended solutions to overcome this roadblock include developing awareness campaigns for the general public and for people living with diabetes, designing medical education curricula with more focus on prevention, and earmarking funding to specifically tackle CVD and diabetes at the national level. Drawing on the expertise of diabetes expert clinicians, researchers, implementation science experts, and patients from around the world, it presents an integrated approach to patient care. In order to be implemented successfully, the roadmap requires committed global action, starting at the local level and involving all key stakeholders, including people living with diabetes, their families and caregivers, patient advocacy groups, healthcare professionals, healthcare systems, public health officials, and policymakers at the local, national, regional, and global levels. The framework provided in this roadmap will support any national and local initiatives, including WHF roundtables for the prevention of CVD in people living with diabetes. How does this work? It's pretty simple, really. First, you identify and bring together key influencers and decision makers. Then, you investigate the gap in care in your specific context. Then you prioritize specific barriers or gaps along the pathway of care. After that, you identify the key action areas to address barriers along the pathway of care based on the proposed solutions. Next, you develop and plan the necessary interventions. And finally, you monitor and evaluate the interventions. The World Heart Federation is supporting the global implementation of this roadmap through our national roundtables, CVD scorecards, the Emerging Leaders Programme, and World Heart Day.